A lot of the patients I see are patients with epilepsy that are intractable, which means they're uncontrolled with at least the initial efforts with medical treatment. And so the initial evaluation is, do they have epilepsy, what kind of epilepsy, and have the appropriate medicines been utilized. We obviously have a lot of experience with a lot of different medicines and can sometimes meet with success with medical treatment. However, if an individual fails multiple medications, 5, 6 medicines, it's unlikely that the 6th or 7th or 8th is suddenly going to stop their seizures. It's at that point that we look at the option of surgical treatment of epilepsy. We usually record the seizures in the hospital on video and simultaneous EEG to identify the character of the seizures and the electrical information or the localization of where they may begin. We dovetail that with a series of other tests, including MRI, PET scan, neuropsychometric testing, and then hopefully are able to identify where the seizures begin and identify and outline a surgical treatment for that we can safely remove part of the brain that would stop the seizures. In the area of sleep disorders, the most common disorder is obstructive sleep apnea, which is very common. Other sleep disorders are a little less common, but maybe a little more interesting to a neurologist, at least, in terms of a disorder like narcolepsy or REM behavior disorder, where people act out their dreams. And obviously we have medical treatments for those that also can be quite effective and rewarding when you're able to impact on the patient's quality of life.